Hi, Dr. Gupta. Thank you so much for joining today. I know that we unfortunately were not able to meet in person as we're practicing social distancing, so it's a little bit harder to tell on video, but I'm actually expecting having twins in June. So, as a pregnant woman, I have a lot of questions with COVID-19, and I know that there are a lot of other women in the same shoes as I am that have a lot of questions. So just wanted to get your thoughts on some of these things today. And the first question I have for you is just as a pregnant woman, am I more vulnerable to the virus?
We do know that people who are more susceptible to this COVID-19 or coronavirus, the novel version, are especially those who are elderly and those may have significant chronic underlying conditions. Those could be conditions such as diabetes, lung conditions, or heart conditions. We also feel, because of our experience with past genetically similar viruses like MERS and SARS, that pregnant women may be at an at risk category. So it's important to not be afraid or worried, but also understand that generally speaking, when a novel virus or any other information that any other virus that tends to affect general population, pregnancy itself is an experience that leads to immunological and physiological changes that might make pregnant women more susceptible to those respiratory virus illnesses, including COVID 19. But taking the precautionary principle in mind, it's important to recognize yourself as an at risk category and take those cautions to make sure that you're doing everything you can in your power along with your provider to keep you safe.
What can I do as a pregnant woman to stay safe and make sure that I don't get COVID 19?
I think, Susan, in order to know that, you also first have to know how does that spread. So we know that COVID-19 has a person-to-person spread. What that means is when people are in close contact with one another, the respiratory droplets that someone who's sick is coughing, sneezing, or otherwise excreting could actually be spread to the person. The other one is also come in contact with people with surfaces, that there may be object and surfaces where the virus may be staying there and could survive for hours. And then, of course, sometimes people can be spreading the virus just before they're showing symptoms. So there could be others who may not have the symptoms, but just about to get sick, and they can also be spreading. Make sure that you're keeping yourself away from people who may be sick. So the best way to prevent illness is to avoid being exposed to this virus. So you want to make sure you're not in surroundings where there is a lot of people could be, or some of whom could be sick. So if there's an option to stay home from work, as you're currently doing, and work from home, that's what you want to do. If there's an option to have someone else run the chores, that's what you want to do. At the same time, you want to make sure that you're cleaning your hands often or using a hand sanitizer that has at least 60% alcohol. You want to avoid touching your eyes, nose, and mouth, because that's often when you are in case have a virus on your fingertips or hands, that's how it spreads through those mucosal surfaces and goes into your body. You also want to avoid close contact, especially with people, as I mentioned, who are sick. So those are some of the basic precautions you can take to make sure that you are not contacting people or getting in contact with the virus itself. Make sure that your vaccinations are up to date. So we know that not only the COVID-19, but we have the flu ongoing, and people can get sick because of that. So in addition to that, your diet is important, your exercise is important.
That's great. Thank you. And I heard you mention using hand sanitizer as a precaution, and I know there's been talk of Lysol products and disinfectant wipes, if you can even find those in the store right now. But are those products safe to use as somebody who's pregnant?
Yeah, so it's important to know that if you're using products that have at least 60% alcohol, that you can use those for sanitizing your hands and other surfaces as well. You always have to make sure that it's being done in a way that other children in the home do not get access to it. These are dangerous products if children were to come across it, or if these products were to be ingested by even adults. So as long as that precaution is being exercised, it's important to keep those surfaces wiped and clean.
I also had a question for you about travel. I know there's been a lot of talk about international travel and restrictions on that. But what about domestic travel? Would you say that it's necessary to cancel any plans at this time, or is it okay to proceed? Or what do you think about that?
We want to make sure that especially in areas that are now seeing a lot more community and local level transmission, that you're avoiding the ability to get the infection to begin with. Understand that when you're traveling in an airplane, you do not have the luxury to exercise that 6 feet of distance from the next passenger. So it may be well worth that if you can avoid all unnecessary travel, that you do that at this time. Of course, your car, you're able to travel. That's a different set of circumstances. But it's important to connect with both your employer as well as your local and state health officials to ensure the guidance on travel because it may be changing. That's available for you.
And then we don't know how long this health crisis is going to last. As I mentioned, I'm due in June. I know a lot of moms who are expecting in the next couple of months. What would you say that they can do in terms of taking precautions for not getting their infants sick?
So it's important that if you are healthy and you deliver your baby, that your newborn is also going to be made sure that you will not expect to have any problems, and you will follow the directions of your provider. For those women who may be PUI, or what we call persons under investigation for COVID-19, meaning that they're being tested for, or they have a diagnosis of COVID-19, it becomes a little tricky because although we do not have any evidence that there is vertical transmission through the placenta and blood to the baby, there's always that risk of the droplet infection that can happen to the baby. In fact, there have been cases of some infants acquiring the virus right after being born. Although the outcomes were fairly good, we want to make sure that doesn't happen. So some of the important pieces of that, especially if you're a woman that has the diagnosis or is being under investigation, you're going to be isolated in a room in the hospital. But if your baby is born, the baby becomes also a person under investigation at that time. So the baby will be tested to make sure the baby does not have the infection, but it will also be allowed to have separate rooms. Now, that's a recommendation, but it's also the willingness of the mother. When we talk about similarly taking care of the newborn through breastfeeding and the other aspects, women really have two options. One is to pump the breast milk and allow that baby to get the breast milk, preferably through another family member or a friend in a separate room. But there's also the option of breastfeeding. For a woman who is suffering from COVID-19 infection, you can breastfeed, but it's very important to take all those precautions like putting a face mask on or a respirator mask on, making sure your hands are washed and clean with soap and water. The site, the local breast area is clean, and then making sure the baby is right after the baby is fed is then again separated to allow the mother to recover as well as the baby to make sure that it doesn't get infected from the mother. So these are some of the precautions that your provider might be taking in those situations versus if you do not have any risk factors and you're not suffering from COVID-19, which would be very different. So it's going to be an individual case by case and that your provider will decide. But there are very good recommendations that are already being provided by the CDC on this issue.
For babies who are in the NICU and they're more sensitive, what restrictions are there in place at NICUs, or what's changing in that environment?
I think it's very important that for those babies who might already be in NICU and not diagnosed with COVID, and there maybe not be any cases of COVID, but the parents, as they are in NICU and going home from NICU, may be worried. And honestly, it's important to note the worrisome, especially in areas where there's a lot of local transmission happening of COVID, and they may need require certain support services and resources that may be in addition to the routine measures. So, for example, we've heard about the toilet paper shortages. There may be that they may have difficulty obtaining diapers or baby formula or other aspects, and sometimes just getting general guidance and education on how to avoid getting infection for themselves and their babies. Because remember, in the first several months of being born, you do not, and you're not able to develop an immune response, even if there was a vaccine. So the way we address that is by cocooning the baby. What that means is we protect the baby from anyone who could potentially be sick. So that measure, when you're going home, you're making sure that while it's a great time to enjoy that initial period, it's also important to protect the baby from anyone else who may have come in contact with the COVID-19 or coronavirus to make sure that the infection is not passed on to the baby.
And then going back to some of the precautions, and we were talking earlier about social distancing, what would you say about having even small gatherings at this time? For example, I have a baby shower coming up, and it would your advice be to postpone that until we know um, that things are safer?
We know that pregnant women, like a lot of other populations, there are some that may have underlying other chronic conditions, such as I mentioned, like lung disease, heart disease, diabetes, and others. And therefore, when we gather together, there's always that risk that unknowingly the virus could be spread to others, even sometimes being asymptomatic or not showing up symptoms right away. And that person could still be spreading the virus. So, therefore, it makes sense at this point to exercise those social distancing measures. So, for example, if you're having a baby shower, perhaps it could be done virtually. There are those opportunities available nowadays with technology that we can exercise rather and avoid really not only the transmission and the risk for that, but also the anxiety and the fear. And when you do have questions or doubts, then talk to your provider. I think it's very important. While on one hand, we're recommending to watch your travel, watch your, going out and shopping and other social distancing activities. It's also very important that, especially pregnant women who may have chronic underlying conditions, to not miss your appointments with your provider because that is so critical. So we want to make sure that your prenatal appointments are very important, and you want to call ahead and make sure that it's still okay to come, but you still do not want to miss your provider appointments while pregnant because remember, while COVID is ongoing, we still have a challenge with making sure that you are having a healthy pregnancy and moves forward. We're in the midst of another crisis of preterm birth, where we have 4 years in a row that the preterm birth rates are rising in this country. So we want to make sure that we're doing everything we can to help support our moms to be with that, and so we have more pregnancies that have a healthy outcome.
Well, thank you, Dr. Gupta. I really appreciate your time on this very important topic, and I hope that you stay healthy.
I hope certainly you stay healthy as well, Susan, and be safe. And thank you for those questions. There, I hope that they're able to help inform others like yourself. Making sure that they are also exercising all the precautions to stay safe.
Great. Thank you.